Well, good morning. I am so happy to be joining you this morning from the office of Dr. Mackay, Vein and Circulation Specialist. Joining me this morning is Marissa Tuffarillo, PA here. Good morning.
Good morning.
We're talking something this morning that I think a lot of us here in Florida are sometimes very self-conscious of, and that's spider veins. And what's really interesting too, you say both male and female, this is a concern for people. So explain what spider veins are. And again, I know a lot of us hate to see them on our legs, right?
Right, especially here in Florida.
Yeah.
So spider veins are just of a cosmetic concern. They're small surface blood vessels that could appear purple, or they could appear blue or pink, but they're of no medical consequence.
Okay, so you don't need to be nervous about them, that it's unhealthy or something could be wrong. It's mainly just an appearance thing that we don't like.
Correct.
The good news is there's something you can do about this. So what is the typical procedure that you use to treat spider veins?
Well, there's different treatment options for spider veins. The gold standard is sclerotherapy, and sclerotherapy is basically injecting a solution, which is a detergent, into the vein that irritates the vein wall to shut it down, and then your body slowly absorbs the vein and it disappears. There are other treatment options like lasers and IPL, which is intense pulse light, but there's still a lot of advances in technology that need to be made. So right now, spider vein sclerotherapy is the gold standard of treatment.
Okay, so how soon can you see results? How many treatments? I mean, this is exciting for people.
Right, so typically most patients average around 3 to 4 sessions. We always let the patients know it'll never be 100%, but okay. Usually we see a good 90–95% improvement. Most patients, again, average 3 to 4 sessions. The veins will look worse before they look better, and then over the next month after treatment, you'll see your veins will slowly absorb and disappear.
I'm sure you get asked this a lot, but how painful? Is there pain associated with this? Tell us what the procedure feels like.
It's not painless, but it's very tolerable. Usually you just feel the little pinch from the needle stick. Some patients that are very sensitive, we can offer some numbing medication to apply on prior to treatment.
Is it a pretty quick procedure, in and out? I mean, can you drive afterwards? I mean, what's the deal?
Yeah, so you're usually in the office for about a half hour. We do let the patients know you don't want to travel after, you don't want to go on a long flight or a real long car ride because of the risk. We have to look at each patient individually and stratify their risk factors to make sure that there's no clotting history, that there's no travel plans.
But it's pretty, yeah, I mean, for the most part, people can come in. Could you essentially come in on a lunch break and do this? I mean,
Absolutely.
It just seems so simple.
Right, we have patients come in all the time on the lunch break, and then they can go right back to work.
That's awesome. So what would a patient typically do? Come in for a consult? How do you know if you'd be a good candidate for this?
Well, we do offer free screenings in our office. You can come in for an evaluation and we'll look and examine your legs. A lot of times you might have some surface spider veins, but you might also have symptoms to suggest a more significant underlying vein problem. So if a patient comes in just for spider veins and then they're reporting swelling or aching and discomfort, we're going to want to do a complete evaluation to make sure there's nothing more medically necessary to treat deeper down prior to any cosmetic treatment.
Okay, and then as we wrap up here, you say this time of year is actually the best time of year to get this done. Why is that?
Absolutely. It's important, again, to keep your legs out of the sun after the treatments, and you will have some discoloration and bruising temporarily. So in the winter, especially here in Florida, is when we can wear pants and keep the legs out of the sun. So it's the perfect time of year to treat your veins.
Okay, so now is a great time to call. You have a great offer for new patients.
Right now we're offering a special where you can get $100 off a new patient treatment.
All right, well, thank you so much again for having us here this morning. I hope people take advantage of that great offer. And again, for more info, head to their website, or our website is tbmorningblend.com.